consultant anaesthetist at Guy's and St. Thomas's. I am the research lead, the clinical lead for Guy's Hospital, but I'm also an honorary senior lecturer at SIE and at CHAPS. I've got a varied portfolio of research that includes areas such as airway management. It includes regional anesthesia and pain. And also I spent a lot of time doing research during COVID. Some of the key things that we learned and that information that I helped to generate and knowledge that I helped to generate in the last few years in particular was our understanding about the risks of COVID, the risks to both healthcare workers and the risks to patients. And one of the key outputs that I think that I had in the last few years was to define the safe timing of surgery after SARS-CoV-2 infection or COVID. And I led up the national guidelines on the 7-week guidance for timing of surgery, hoping to update that with emerging evidence soon as well. The key things is we have the evidence that we've built and we've generated and helped to understand and contextualize has helped to improve the safety of airway management for patients having general anesthesia for either elective surgery, emergency surgery, or for supporting their airway when they're critically unwell. So this has made that process safer for patients. The other elements that we've really worked on and tried to improve is timing surgery appropriately so that patients, not just in Southeast London, but really globally, have surgery at an appropriate time to make sure that their post-operative outcomes are as good as they can be after a COVID infection. Well, obviously, it's a massive honor to be awarded the Featherstone Professorship. It's a very prestigious award that's given once a year to very, very few people actually who have an opportunity to even be considered for it. So it's a real honor. But the truth is, to a certain degree, I feel a bit of a fraud because I feel like that award and that professorship should go to all of the teams that I've worked with, because everyone pulls their socks up and gets stuck in and works really hard. And I'm a very firm believer in collaboration and teamwork. And I've been just very fortunate and humbled really to work in such outstanding teams. So I feel completely honored to have been awarded the Featherstone Professorship, but I think it symbolizes my teams more than me as an individual. Being part of KHP gives me all of the ingredients that I need to go and start cooking academically. And I'm very, very fortunate in the support that I've received from KHP, and I'm looking forward to doing more, developing more, investigating more, and learning more for the benefit of all of our patients with the support and partnership with KHP.